facial sculpting today to one of my beautiful patients. I'm not allowed to tell you his age because he looks way good for his age. And he's here from Vegas getting some facial sculpting for his birthday. So we're going to do some focused areas in men, specifically the under eyes, the mid face, and around the mouth starts to age earlier. You see jowls, you don't have as much definition in the jawline and chin, and we see some under eye hollows. So that's the area we're going to focus on. And also when the middle face starts to age and you lose volume and you're thin and athletic, like my patient is here today, the folds of the face become more prominent. So you can see here he has some significant folds, and he also has some sort of sagging and looseness here because he's really lean. So our goal is to give a little lifting through volumization of the middle face and some softening of the lines, and then we're just going to make his lips look nice and plump, and then overall the whole central face, which draws you into somebody, you know, with your eyes, nose, and mouth being the first things people look at, will give him a little bit more of that subliminal beauty. So turn a little to your right, look all the way up. We're going to use a cannula here using Radius, and I'm going to focus on doing mid-face volumization. The way in which we're going to do it is different for him because his face is very structured. So our goal here is to actually volumize this entire area in what's called a scaffold. And from this area down, we're going to want to volumize the deep fat pads. So we're going to just do little threads, very small amount, and Radius is going to help build collagen over time. So we're just going to do little small amounts. There's some numbing in here, so you won't feel it so much as it goes in. Turn a little bit more right for me. Great. And again, right here, we're using a cannula, which shouldn't be too painful, but this is going to allow me to give him a little more volume than if we just did some depot injections on the bone. And that will allow the mid-face to kind of build collagen over time. So now we're going to go to the opposite side. We're going to do that same thing over there. We're following what I call the facial triangle, which is right here, and in the lower part of this triangle is where we want to go to give lifting through this entire middle area. Weird feeling, but we're going directly in through the tissue, nice movement. You could see the cannula limits bruising and pain. We're doing some little struts or pillars. Look to the left a little more, and then look up a little higher. There you go. Great. Right there, and all of the fat pads in the mid-face. We're going all the way down in the struts to give some supporting volume. Deep medial fat pad right here. But by using the cannula, it limits our risk of major complications, and we can move through the tissue a little bit better.
How long will this last time?
The Radius typically lasts about a year up to 15 months. So it just depends. Now we're going to be building over the course of the year with him. Let's go ahead and watch a little drop of blood. We're going to be building over time. So right now it's just the starting point. He's going to need more volume. Turn a little this way. You can see already the volumization's improved. Now we're going to go to his fold. Now, when we did the clinical trials for Radius, and come on in close, you can. When we did the clinical trials for Radius, the average male needed about a syringe a side when they had deep folds like this. We're starting out with just half a syringe for him, just to get a nice improvement, nice and slow. You okay?
Yes, I am.
You're doing amazing.
Thank you. You are the one that is doing amazing.
Thank you. Thank you. Well, I love what I do, you know.
Yes, you do.
I really want to get him a nice improvement here. So not only do we go to the fold, we're going to go right above the fold into the deep fat pad right here to give a little support as well. There we go. you understand the anatomy of the area, it's very safe to do that technique. But that was an advanced technique for those that are looking at doing cannulas. You gotta be really cautious, even with a cannula. Okay, now we're gonna go to the opposite side. And we kind of dance back and forth because the numbing medicine kicks in and it doesn't feel as bad. Any questions on there?
Is it painful?
Doesn't seem like it. What do you think? Is it painful?
No, not really.
You need that needle back. There you go. Never mind. It's a
Do
weird
you-
feeling. Go ahead.
Do you always do mid-face before the nasolabial folds?
Yeah, it's better to do the mid-face first to get some lifting so that you don't need as much in the fold. With him, we know we need a little bit in both. So that's why we're kind of contouring both. I'm actually going to go back in a minute and do a little more to the mid-face too.
And what are more long-term options if you don't want to just do fillers?
Well, he could do a cheek implant. You could do fat grafting. We could do other fillers that last longer, like Bellafill. Again, we're going to go to that mid. From here, we're going to go to that mid fat pad and give it a little more lift. Just got to understand the anatomy and go really slow. But you could do longer term fillers if you really wanted, like Bellafill, for example. Okay.
How do you know if you're in the correct plane?
Experience and technique over time. Now we're going to use a little bit of needle to get some lifting on the bone. And this is the key because we've filled some of the actual soft tissue. Smile for me a second. We want to give him some actual lifting because he is a very smiley guy. Got to get some lifting. So we're going to go on the bone and a few strategic places for men especially. Nice and slow.
Does this filler stimulate collagen?
It does. It's one of the few fillers that does. For men, I like to give him a little bit, just a little bit of a cheekbone, not too much, because his face is a little slimmer, but just that subtle hint up top. Good. This filler, like, smile again, relax. Like Bellafill and Sculptra build over time, a little bit. We're just doing strategic lifting points right on the bone, not too much.
What depth do you inject the mid-face and nasolabial folds?
Well, it depends. What we just did, the subcutaneous, with the cannula, was in the subcutaneous layer. I hold right there for him. But what I'm doing right now is on the bone. Can you see the other side? Okay. Just balancing both sides. Nice and slow. Okay. Radius always looks a little more filled compared to others. Now we're going to switch to a softer filler that I'm going to use a little bit on the folds. This is called Wrestling Refine. I'm going to use it on the folds and his under eye. And this is just a softer hyaluronic to give us a nice layering blend so that Radius has more structure. So we don't want to fill the whole face with structure. Yes, we want him to have longevity, but I also want him to look nice and soft. And we're also going to do smile as big as you can. Relax, good. Just a little bit to his under eye area, especially in this lateral corner. Where people start to age, they lose a lot of volume over here on this lateral part of the eye. I know everybody wants to inject the trough. You okay? Good. Now I'm going to give him, I have a special technique to give a little lifting. Whoop, this can happen sometimes. Have him call me another refine. The refined broke. The refined broke, so he's gonna get an extra syringe, which is good. We'll go to the lip in the meantime. Refined, any of the fillers can pop out of the syringe, so we're just replacing it. So now, let's take a look at his lip. It's already a beautiful shape. So all we're gonna use is a very soft filler called Volbella. This hurts a little bit. And I'm just gonna do very subtle. Little baby bits. Nice thin threads. We're going to keep his overall shape that he already has and just enhance it. This is called a pillar technique. I think it's good for guys that have a nice, already elevated, reverted upper lip. Perfect. Now we're going to go right into that middle area and do just a subtle bit there. He just wants a mild change. We'll go back to finishing the mid-face in a sec. You can see nice and subtle. We're going to follow his natural shape. Now, if he follows this Lucian Clo lip plumper consistently, his lips are going to look very beautiful. One more little pinch here. Perfect. Those look great. That one back. Perfect. So just keep that other one in row. Okay. Now we're going to go back to the opposite side and finish up the sculpting using the rest of the refine. No extra refine today. Nothing wrong with that. We're using much smaller needles here, so when you use that, sometimes the pressure is a little bit higher on the needle. Again, that softer look. We are doing some to his folds. And again, we're going to focus on that upper part of his eye. Just a soft bit into the areas where men start to hollow a little bit laterally. Smile again. Good, relax. We're going to do one into the actual trough itself. Just a small amount. Perfect. And then we're going to balance his middle face by a technique where we actually pull the skin back. We inject and pull. Okay, you see that? We inject and pull, and that gives a lifting effect because this filler is like honey, so it actually sticks under the skin. Good. So we're going to go to the other side, do that same thing, and then he'll be done. Smile. Very good. And do a little bit to the trough on this side. And then we're going to finish that. Perfect. So let's wipe them off. We got his little birthday extra syringe. Maybe that's why it happened. It was just good luck for you to have an extra syringe for your birthday. But we did imbalancing of his lip folds and mid-face. And he had a more difficult mid-face because his facial shaping is where his face is more hollow in the middle. But you can see a little bit more volume here, a little less of a fold, and a little improvement in the eye. What do you think?
Wow.
What do you think of the lip? I love the lip. It's one of my favorite parts. But overall, when you smile, it's more lifted, and you see this is going to kind of pull back over time. We'll do things like threads or fractura or even a lift at some point. There's a little swelling on both sides here. Once that goes down, though, you'll be more structured. Yeah. But the key is you don't want to over-volumize here because we need the chiseling effect still. So even though we did do some volume there, we kept it to a reasonable amount because you don't want to overfill and make him round from a chisel effect. So happy birthday.
Thank you, doctor.
You did great. So we're done with male facial sculpting in West Hollywood. All right, so now what I do, let me take a with the after photo, and then we'll put you under red light. That's it.